So I think we're at 6 o'clock now and the webinar has commenced. So I would like to welcome everyone to tonight's webinar, and we're talking about clinical teaching in motion. And what we're going to do tonight is to provide some practical strategies for teaching effectively in clinical settings. And that means you can engage learners, promote clinical reasoning, and weave teaching seamlessly into your daily work. Before we start, I would like to acknowledge the Bindal and Wilgarukaba peoples who've been caring for the region that we're broadcasting from tonight, Townsville. And I'd like to pay my respects to elders past and present and extend that respect to other Aboriginal peoples and Torres Strait Islander peoples who are present here today. So we are the presenters tonight. So we have myself, Karen Carlisle, and Dr. Lisa Simmons joining for the webinar tonight. And I'll just give a brief introduction to myself and then I'll pass on to Lisa to introduce herself. So I am an associate professor in medical education and I'm also the course coordinator for the health professional education courses. And just very briefly, I've got a background in psychology and education. I teach into health professional education research and also the MBBS program here at JCU in Townsville. And so I'll hand over to Lisa to briefly introduce herself.
Thanks, Karen. My name is Lisa and I'm an educator and researcher in health professional education here at James Cook University. I've been an educator in higher education for more than 13 years and I currently coordinate and teach subjects focused on clinical teaching, innovation and quality improvement in health professional education. My research focuses on enhancing clinical learning experiences and evaluating student-led healthcare services as models for both education and healthcare delivery. And as you'll see a little bit later, I'm passionate about creating effective learning and teaching environments to improve learners' overall experience and their learning outcomes.
Wonderful. Thanks so much for that, Lisa. Thank you. So just a brief overview of the webinar. We're educators, so we do have outcomes that we'd like to achieve. And by the end of this session, we hope that you're going to be able to identify learning opportunities within those routine clinical interactions and be able to apply strategies to engage learners in short, focused teaching moments. And also use questioning techniques that stimulate higher order clinical thinking. At the end of the session, I will talk a little bit about our postgraduate study options in health professional education here at James Cook University. And that's for those of you who might like to build on those skills further. There's also an opportunity to have a Q&A at the end. So we are encouraging that interaction and please put your questions in the chat. Before we move on I want you to have a look at this picture on the slide. I really love this picture. What I love about it is that it perfectly captures the essence of the topic we're covering tonight, and teaching moments are everywhere. So even in a busy, resource-limited setting like this, you can see the clinician pausing to engage a learner. And it's a great reminder that wherever we work, whether we're in hospitals, clinics, or rural outreach, every interaction can become a learning opportunity if we take a moment to recognize it. Next slide. So when we think about healthcare settings, they're often fast-paced, unpredictable, appointments can run over time, unexpected cases arise, or urgent situations demand attention. And all of a sudden that day has just disappeared. And many of us feel there just never is enough time to teach. But the great thing is that teaching doesn't always need a classroom or a long formal session. And some of that best learning happens in the flow of everyday work, in those quick, unexpected moments that connect directly to patient care. So my role tonight is really to set the scene for this session before handing over to Lisa. And what we're going to do is look at how those teachable moments, or what we're going to call T moments, are all around us every day, even when that time or that day feels impossibly tight. Next slide. So let's think about where those T moments can happen. And like I said, they're actually all around us. And once you start noticing them, I think you can't unsee them. So these are some examples on the screen. You might have a ward round and you might pause mid-discussion and ask, what's your differential here? Or what would you do next? And that tiny pause turns routine patient care into a quick learning moment. During a patient assessment, you might ask the learner to talk through their reasoning. If you're a physio, you could say, walk me through why you chose that technique or exercise. And it encourages that reflection right there in the moment when that learning's fresh and real. In procedures or clinical skills before getting started, you might be asking, what are the key steps or safety checks here? And that helps learners think ahead and builds those safe habits without taking extra time. Handover, there's another opportunity, and you could invite a learner to summarize priorities or anticipate risks. Even case conferences, I think there are opportunities there for teaching. What are the stories behind this case? How I might see this from the patient perspective, and that can open up those rich, reflective discussions. So these are just some examples that have built-in opportunities for teaching, no extra time needed. They're quick, spontaneous pauses where we link thinking to doing and turn care delivery into real-time learning. So I want you to think about your own day for a moment, where you could pause just briefly to ask a question, share a reflection, or invite a learner to think out loud. And it doesn't have to be clinical. It might be that chat in the corner, a team corridor, a team discussion, or even a debrief after a tricky situation. Every one of those moments can be a learning opportunity. These moments all share the same principles. They're short, they're part of real work. They could be focused on reasoning or communication, decision making, so not just those facts. And what they also do is model that reflective practice in authentic, everyday contexts. So, of course, there are barriers, and we've all felt them, and I do feel them, especially when we're under pressure, that time pressure, or you're running behind. You might be juggling patients, or you've got lots of paperwork to do and those competing demands. But even a 1 minute teaching opportunity or teaching moment counts. And those little snippets of learning, they actually add up over time. We've also got those competing priorities. They're all part of daily life. But teaching doesn't have to take away from that patient care, and it often enhances it. So when we pause to explain our reasoning, we're actually sharpening our own thinking. When we invite reflection, we strengthen team communication. Then there's confidence or maybe lack of it, and not everyone feels ready to teach. But the truth of it is you don't have to know everything about everything. So learners gain just as much from you from seeing how you think through uncertainty or how you might look something up as they do from what you already know. So within that, you're modeling that curiosity and not perfection. And certainly I try to model that in my own experience. And I do this all the time in my teaching, that I would ask the students to think through or where they might look something up as well. So I'm modeling that curiosity. And then there's learner readiness. So it's important that you understand whether learners are ready for that. So that quick check-in. So what do you want to get out of today can make all the difference. And it helps you focus on what really matters for them right now. So ultimately, it is about that mindset shift, moving from I don't have time to teach to every interaction can be a learning opportunity. And so when we start to see it that way, teaching stop feeling like that extra task, and it becomes part of how we care, how we communicate, and how we collaborate. And then so what we're hoping is that over time, those small, consistent team moments start to change that culture, creating teams where learning is shared, encouraged, and valued, even on those busy days. So I'm just going to finish up by bringing this to life with an example. If we just move to the next slide before I hand over to Lisa. And this example is just really taking through what some people may be experiencing in everyday work. But you might be on a busy morning shift and you've got a student nurse with you called Maya. We'll give her a name. And you're checking on Mr. Johnston, who has hypertension and diabetes. And Maya's taking his blood pressure and it's 160/95. And you might pause and ask, what would be a normal blood pressure for this patient? You might follow up with, that's a bit higher than usual. Why do you think it might be higher than normal for this patient? And Maya might offer, well, maybe he's stressed or hasn't had his meds yet. Together, you check with Mr. Johnston, and he confirms that he hasn't taken his medications yet. And that simple pause becomes a teachable moment, connecting data with clinical reasoning and involving the patient in that care. Later, During medication administration, Maya is going through the drug. She's explaining each drug using medical terminology. And as you're by her side, you notice that Mr. Johnson's looking uncertain. So you might say to Mr. Johnston, could you tell us in your own words what those tablets are for? And he isn't able to do so. And then what you might do is gently guide Maya to rephrase using plain language so that he has that better understanding. There's another teachable moment, this time about communication. After this interaction, you might take a minute to debrief. What did you notice in the interaction between you and Mr. Johnston? And Maya might reflect on it and say, I focused on the task and not that bigger picture of the patient needs. So in under 5 minutes, you've taught reasoning, communication, and reflection, all without stepping away from patient care. So that's what we mean by team moments in everyday practice. They're short, real, and transformative. So that's everything from me in terms of setting the scene. I'm now going to hand over to my colleague Lisa, who's going to go through some real practical strategies to help you move from team moments to team moves. Thanks, Lisa.
Thanks for that, Karen. So we've just heard about creating team moments in everyday practice. The starting point for becoming more intentional educators is to identify purposeful moments in your everyday teaching work. Starting small and making these moments visible will form the foundation of your work as educators. So I'm going to build on this concept by introducing some structure through a very pragmatic approach, promoting learning through questions and implementing effective and efficient team moves. Healthcare and clinical workplaces are fast, complex, and chaotic. Patient care rightly takes priority. The context produces cognitive overload for both teachers and learners, so teaching can sometimes feel like an add-on rather than part of the job. Most of us learn to teach from classrooms and ward tutorials, so we perhaps equate real teaching with a sit-down or didactic section. And many clinicians have experienced that rapid fire recall questioning delivered in open public settings when questioning feels adversarial and it can create or threaten psychological safety and shut down our thinking. That memory makes us avoid using questions in our own teaching. We often conflate formal appraisal with informal feedback, so frequent comments feel intrusive. We don't want to embarrass our learners or disrupt the flow of care, so we avoid pushing our learners with questions. So all these concerns are understandable in busy clinical work. The misconception is that questioning mostly slows us down. But in reality, when it's purposeful and well-structured, questioning is one of the fastest ways to promote learning through or without disrupting care. The answer isn't to find more time, though I appreciate that it would be nice and certainly beneficial. The solution is to add structure and safety so brief teaching moments do more with less. So in this session, we'll cover 3 topics. First, we'll introduce microstructures that make teaching part of care. So we're going to draw on the teaching of the run approach to give a simple spine to short, predictable teaching moments. We'll then promote replacing high-pressure recall with purposeful scaffolded questions because done well, questioning increases participation, it reveals reasoning, and it improves our decision-making. And then we're going to connect this to the role of skilled health professional educators in creating psychologically safe environments that sustain both learning and the workforce, rather. So that's our path for the next 25 minutes. Teaching on the Run began as a practical series by Fiona Lake and colleagues at the University of Western Australia, which was then published in the Medical Journal of Australia in the early to mid 2000s. It was written for clinicians who teach in the middle of real work, so on ward rounds, in clinics, and in theatres. And the emphasis was on short, structured, repeatable teaching moves rather than long tutorials. So in this approach, there were 2 anchors that governed its application. Firstly, structure in minutes, not hours. So the teaching of the run uses a set dialogue closure structure where we first orient the learner and then we run a focused exchange using questions, then closing with a clear takeaway and application. The second anchor is assessment and feedback, and this needs to be woven into daily work, giving regular, constructive, little and often feedback. Teaching on the run has truly stood the test of time. So this is largely because it remains tightly aligned with our contemporary evidence around effective teaching. So we're going to draw on the teaching of the run framework, and I'm going to now focus on how to promote learning while keeping that experience positive for both our learners and ourselves. So people ask and answer questions only when they feel safe to do so. So before we explore with questions, we must create that safety. Psychological safety means believing you won't be punished or humiliated for speaking up, asking questions, raising concerns, or making mistakes. So let me set the stage for psychological safety by walking through 3 models that have shaped how we teach and learn in healthcare. So in 1990, William Kahn described psychological safety as the condition that lets people bring their selves to work, their full selves to work. They speak up, engage, and contribute without fear of negative consequences. In 1999, Amy Edmondson gave us a team level view where psychological safety is a shared belief that the team is safe for interpersonal risk taking. Teams with higher safety show more learning behaviours. They ask for help, report errors, experiment, and adapt. And more recently, Timothy Clark offered a practical shared language. And this language helps us diagnose what's missing in the moment. Do people feel they belong? Are they safe to ask and try? Are they invited to contribute? And can they challenge your ideas respectfully? These models are not isolated approaches. They are instead very complementary. When we use these principles together, they explain why our short, structured teaching moments really work. We reduce threat and distraction while coaching reasoning with our calibrated questions. So to provide you with a simple framework for how this might look like in your practice, I'm going to now briefly take you through the 4 domains of Clark's model. So domain 1 is inclusion safety, creating a sense of I belong here. Inclusion safety means removing guesswork, reducing isolation, and making belonging visible from day one. To achieve this in practice, you might set ground rules and expectations for your interaction with your learner. This could be reassuring learners that questions and uncertainty are normal. It could be providing opportunities to regularly debrief or coordinating specific roles for participation to reduce the isolation of your learners. Domain 2 is learner safety, where it's safe to ask, try, and make mistakes. Learner safety means making the purpose clear, protecting a little thinking time, debriefing with structure, and shaping that environment so learners can safely ask, try, and learn from those small errors. To achieve this in practice, you need to give your learner some time and grace. So provide teaching pauses so the learner gets time to have a break and relief from having you expecting something from them. You need to promise time to think before they have the opportunity to provide their answers, and you need to normalize uncertainty. Domain 3 is contributor safety, which ensures learners feel that they add value. The aim here is to make it normal for learners to offer their own thinking and see it shape care. To achieve this in practice, use purposeful scaffolded questions to allow your learner to show their contribution and then use their ideas in your practice. Domain 4 is challenger safety, where learners feel safe to question the plan. The goal here is to make respectful challenge part of normal teamwork and not a rare event. To achieve this in practice, provide an opportunity for learners to critique the approach. You might want to ask questions like, what are we missing here? Are there any risks we haven't identified? You need to build structured moments that allow our learners to respectfully challenge our plans. When the 4 domains are in place, questioning strengthens rather than threatens the learner's self-belief and self-esteem, making it truly an effective teaching strategy. So when we use questions as a teaching tool, we shouldn't be using it as a test. Used well, questions activate thinking. They surface gaps and guide the next step in care. Reviews in medical education consistently show that effective questioning increases participation, concentration, and understanding. However, when we use them poorly, it can threaten or humiliate learners and influences them to shut down. So, as educators, we want to ensure we achieve the former and not the latter. Questioning should model clinical reasoning. We are letting learners hear and practice the mental moves that clinicians make. We should use questioning to scaffold progress from recall to analysis to application. And when applied with a little think time, questioning promotes better responses and reduces learner anxiety. However, saying questioning works and we should use it doesn't really help you apply these principles. So I'm going to now spend some time to introduce you to a simple, reliable routine you can use at the bedside, on the ward, or in other healthcare or educational settings. So step 1, set the frame. The purpose of step 1 is to outline what we're about to do and why, define what a good response looks like, and provide a time limit on the exchange so it won't go on forever and the learners know what they need to commit to. You also need to promise time to think and adhere to those principles of psychological safety, as well as try reduce noise and distraction so the learner has the capacity to reason and not fall into data dumping or just guessing what you want. So let's now provide an example of what that could look like in practice. On the screen, I have a little outline of what we need to achieve when setting the frame. And I'm going to provide an example at each step of this structure. So context. We are now going to do a quick teaching pause on this chest pain case. Okay, so in saying that, what I'm doing is explaining the context in which your questions will relate to. So I'm setting the scene. I need to then develop a goal. I'm looking for your working diagnosis. I want one discriminator and a first safe next step in managing this patient. So here you have identified the outcomes you would like from the teaching moment. Process. I'm going to ask you 2 questions. Here I've set parameters for the question so the learner knows what is coming for them essentially. And then the product. I want you to answer my question in 2 lines. So the learner now knows what commitment they need to make. You need to set a time frame. I'm going to give you 2 minutes before I need you to answer. So this ensures that it doesn't go on forever and you have a marker for when to move on or to provide prompts and support to your learner. And then finally, safety. I'm going to leave a few seconds of think time before I call anyone. Uncertainty is welcome and you can ask questions of me. So step 2 turns questioning into coaching and not quizzing. The goal here is to surface clinical reasoning quickly. So teaching targets the learner's actual thinking and build thinking in a stepwise fashion from simple recall to justified decisions without overwhelming working memory. Now, there are many models for designing good questions, but a simple model that informs how we design learning activities is Bloom's revised taxonomy. This model can act as a ladder to effectively scaffold questions. So just briefly, Bloom's revised taxonomy is a framework for categorizing educational goals into levels of cognitive complexity, from basic to advanced. It is organized into 6 levels: remembering, understanding, applying, analyzing, evaluating, and creating. The revised taxonomy uses action-oriented verbs to make the levels more accessible for designing learning activities. So going back to my ladder analogy that I have on the screen, learners stand on different rungs. A competent trainee may not need questions focusing on the remember, understand domains, while a novice may not be ready for questions drawing on the evaluate or create domains. So your task as the educator is to match each question to the cognitive demand of the task, as well as the learner's readiness, and then climb one or two rungs as needed until the learning objective is met. Okay. So let's look at some examples of questions at each level of Bloom's revised taxonomy. So to achieve remember, the learner retrieves essentials or foundational knowledge. A good question in this domain may be, list the red flags you're checking for this case. So this is a good question because it tells the learner exactly how much to say and what kind of answer you want. A not so good question might be, tell me what you know about chest pain. So this is not so great because it's broad and it encourages learners to start dumping those facts, okay? So everything's going to come out of their mouth. That wastes time and it makes it harder for them to remember the key items you actually need them to know right now for that case. To achieve understand, the learner needs to show meaning and understand relationships. So a good question might be, in one sentence, say why that finding matters for this diagnosis. So this is a good question because it keeps the answer short and focused, tying the comment to the patient rather than a textbook. And that lowers pressure and keeps the team moving. A not so good question might look like, explain the entire pathophysiology of heart failure, which I think when you hear that, you know that that's not quite a good one. The reason for that, it invites a mini lecture. Okay, so this is particularly true if they don't provide an accurate explanation of the processes that are involved in the pathophysiology of heart failure. And that can be very stressful for the learner, and it doesn't help to show their understanding of today's case. In apply, the learner uses their foundational knowledge and applies it to the patient and that specific context. A good question might be, what single mobility task can we do today that will determine discharge readiness? So this is a good question because it picks a straightforward task and has a clear sign of success. Okay, the learner knows precisely what you're checking and can aim for it without guessing. A not so good question might be, what exercises could we try today? And I've actually done this one many times. And this is not so good because it invites a long list and doesn't help us decide whether it's safe to go home or not. So it has no practical application. This style of questioning makes it hard for the learner to retrieve the answer that you're looking for, and it doesn't influence practice. Analyze is where the learner weighs the evidence and compares or contrasts the information. So a good question might be, give one sign that they can shower on their own and one sign that they might need help. So this is a good question because it pulls out evidence for and against, which makes the next step and the decision-making behind it clearer. A not so good question could be, do they need help in the bathroom? Okay, so this isn't great because it's quite broad and binary. So you'll probably get a yes/no response from your learner, and you won't hear the specific reasoning behind what led them to this decision. That doesn't teach the learner how to think it through. In evaluate, you are asking the learner to justify a judgment. A good question might look like, should we make a safety plan today and get a senior clinician to see them, or is normal follow-up okay? This is a good question because it forces a clear decision and asks for one safety reason based on the person's situation. they will be required to evaluate their decision against a criteria. A not so good question might be, what do you think we should do? Okay, I've done this one myself as well. This isn't great because it's unclear. So learners may talk for a long time without deciding. This may look like they're guessing the right answer, or as I've said previously, data dumping all the information. It also doesn't say what matters. So to evaluate, you need to provide a criterion for the learner to assess their decision against or without it. The answer can drift, or it can feel like it's a shot in the dark. To achieve the goal of creating, you want your learner to design something new based on the patient's unique circumstances. So asking the learner to create is quite a complex task. So you may need to offer a layered question. So a good question might look like, design today's feeding plan. What texture volume should we try? What signs do we need to look for to determine if it was safe or not? Or what will our next step be? So this is a good question or questions because you're providing clear criteria that the learner needs to achieve in their response. That reduces confusion at the bedside and helps the learner feel confident about how to answer. I would offer the whole question first and then break it up for your learner to step through one section at a time. A not so good question might be, what should their swallowing management be? So this may not be great because again, it's quite broad. You won't get a specific plan on what to do today or when to stop or what to switch to. And this doesn't influence your everyday practice. So let's move on. In step 3, we are trying to hear how the learner is thinking, not just the answer. We are looking for the evidence they used and what would make them change their mind. So probe the reasoning, not the person, means we ask about the thinking process behind a decision rather than judging the person's knowledge or competence. When we focus on the reasoning, learners feel safer, they think more clearly, and we get better answers. So there are 2 types of probes that you can use to investigate the learner's thinking. First, the evidence probe. What evidence led you there? And if they stall, I like to say, take a moment. Give me one finding that pushes you that way. So doing this adds a parameter to the amount of information they need to draw on to answer the question correctly. And this helps to target the learner's thinking more effectively. Second, the change your mind probe. So what would make you change your mind? And if needed, name one thing that would flip you to the other option, okay? And this shows me the key signs or facts that shape their decision. And again, if they stalled, I've added that parameter to help them target their thinking. So it's essential to keep the tone neutral and give 3 to 5 seconds of quiet thinking time after each question. This lowers pressure and it improves the answers that you'll get. It's also important to avoid rapid fire recall or vague prompts like, what are your thoughts? And we also want to avoid personalizing and opening with a negative, such as, why didn't you do this? These just waste time and it can increase the learner's anxiety. In step 4, we are sealing the learning opportunity and supporting the learner to instill useful change. So the rule is where you provide a short but memorable principle. And the next step is where you give one specific tweak that the learner can use on their very next case. So keeping it to one rule and one next step gives a clear takeaway with better translation into practice. Now, even though I've just provided you with a do this, don't do this approach to designing questions, I do want to let you know that you are not destroying the effectiveness of your teaching and learning environment by asking bad questions. Not all questions need to have this structure. Depending on the context, broad questions can work well. Sometimes it's more beneficial to take advantage of the situation and use it as a teaching moment. And broad or ill-defined questions can always be saved with more specific scaffolded questions, okay? So it's not, death by questions, but it definitely can help you by framing what you want by just adding on a few more questions. However, there are some basic design principles that I do want you to think about when using questions as a tool, particularly a teaching tool. Use both open and closed questions on purpose. So closed questions are great for establishing a floor of knowledge, where open questions push analysis and justification. So choose deliberately for the objective at hand. If nothing else, we need to be intentional about our teaching practices, which will support a better learner experience and improved learning outcomes. Match the difficulty to the learner and the moment. So adjust the complexity as competence grows. Aim questions towards high order thinking as your learner is ready. Minimize extraneous load. So step to a quieter spot if you can. Orient the task and break big problems into parts. These strategies protect working memory, allowing reasoning to occur. And lastly, audit your own questioning. So periodically sample your questions, the levels used, the wait times that you give, and how your learners experienced your tone. Invite a colleague to observe or ask your learners for feedback. I'll just go back for a sec. So this brings us to the end of my little teaching moment with you. But before I hand it back to Karen, I do want to connect the importance of effective teaching practices and how it can influence the bigger picture of healthcare and workforce sustainability. When clinicians can set the scene, ask good questions, and give brief, constructive feedback, learners progress faster and make fewer repeated errors. Teams become safer to speak up in, problems are surfaced earlier, and care improves. And remember, people stay where they have been allowed to grow. So essentially, effective teaching skills create better learning moments. Repeated day after day, those moments build a strong learning culture, and a strong learning culture sustains the workforce. Having a skilled workforce is critical to ensure this lasts. It involves having the right people with the right skills for the job, backed by appropriate qualifications. So effective teaching becomes everyday practice. The learning culture endures and the workforce stays. So thank you very much for taking the time to listen to my little teaching moment with you. I'm going to now hand back to Karen, where she's going to cover some of the courses that we do here at James Cook University.
Thanks so much, Lisa. And I really do appreciate that teaching moment or tea moment that you've delivered tonight. And just to flag with the audience tonight, this recording is being recorded. So a lot of information being shared tonight, and would highly encourage you to go back and review. I think there were some great tips and great advice on questioning throughout that session. So you can review the webinar again if you're interested. So thank you again, Lisa. And I'm just going to finish off the webinar and talk a little bit about what we offer here at James Cook University in terms of studying health professional education. And I think certainly Lisa has provided a great insight on some of the things that we do cover in the courses. So I've got a couple of slides, so I will go into more detail on some of the information, but this is an overview of the courses that we offer. And essentially, the programs are really flexible and they do build on each other. So you can start with doing a graduate certificate in health professional education. And then if you're interested, you can progress to do the diploma and then going on to do the master. And we have many students that do exactly that. They've maybe been in working in health professions for a number of years and have decided to dip their toe back into study, and they build on that experience and go on and do their masters. This course or these courses are open to all registered health professionals. So you could be working in medicine, nursing, or allied health. We get quite a lot from those three broad disciplines. Or if you have a relevant bachelor's degree and a couple of years of teaching under your belt, you also have eligibility to join. If you are unsure, really happy for you to get in touch with myself or Lisa, and we can chat through your eligibility. We're very open, and we do engage with students who are interested in enrolling. The courses are fully online. We now have 3 intakes a year. So we have intakes in January, May, and September. So really flexible. So when you feel you want to enroll, we've usually got an enrollment date that will fit your learning needs. If you're an Australian or New Zealand citizen or permanent resident, you also may be eligible for Commonwealth supported place, and that brings those costs down. I've put some costs on the screen there. It's approximately, for this year, it was $4,600 for the grad cert. I have included links to all the course pages here on the screen, and all of the details of each of the courses, including things like fees and entry requirements, are on the JCU website. Just following on with some additional information, we also offer recognition of prior learning. So you may have completed some relevant studies or other courses in health professional education. And if that's the case, you may be able to apply for what we call RPL. And we're really happy to discuss your specific situation again, very open to that. Okay, so next slide. Wonderful, thank you. So this is a quick overview of the breakdown of each of the courses, and really starting with the graduate certificate in health professional education. We have 4 subjects, and we start with teaching for learning in health professions. And that is one of the foundational subjects, and you're going to explore those key learning theories. We also look at cultural perspectives and practical ways to plan and run engaging learning sessions. And we draw on strategies around blended learning, micro skills, and clinical reasoning. We begin to introduce some of those concepts. So that's the first subject that we offer. Then we move into strategies for clinical teaching. This is a subject that Lisa leads, and it's all about putting some of that theory into practice. You'll be teaching real sessions. You'll be learning to give effective feedback. There'll be elements of teaching procedural skills, use simulation, role play, and online tools. So we're very much into that practical space. Then we have innovative teaching in the health professions, and this is a chance to get really creative. And again, Lisa leads this subject. And it's really about how to use multimedia, simulation, developing teaching videos, podcasts, using AI, really to enhance learning. So that's those first 3 subjects. And then to wrap up the health professional education graduate certificate, we have the capstone subject, which is health professional education using action research. And this is really where you're expected to design and evaluate your own teaching project using that action research approach. So that's the graduate certificate and the subjects that we offer. And then just very briefly, the graduate diploma, we're starting to build on what you've already learned. So we look at assessment and evaluation. We've also got curriculum design and renewal. They're all both key responsibilities if you're into educational design. We also look at leadership in health professional education, and there is a research methods elective in that. And that's really, that research is certainly going to be connected with your own teaching or workplace. Then the final subject is, the final part of the course is the Master of Health Professional Education. And if you're interested in doing the Masters, we have it split up into doing a research project. And you'll be completing your own larger scale research project. And like I say, it's usually connected with your workplace. Many students go on and publish their work, and some have even gone on to do a PhD after completing their Masters. So that's an overview of each of the different courses. If we just move on to the next slide, I've just got some other important points to think about the course. So we believe that this course is really perfect for health professionals who mentor or train others. We have a particular lens if you're in rural or regional Australia, but that doesn't discount anyone who's living in metro areas. But we do have quite a number of students who do enrol from those settings, particularly if they've got students coming through their health service. I think it's really good if you're helping shape that next generation of health professions. This course is really designed with you in mind. I talked about the flexibility. It's built in there, and you can study one subject per trimester, and that makes it really easy to balance that learning with your work and life, and everything's fully online. So you've got those short lectures, videos, reading, and also interactive activities. Saying that, we're studying online, but we do appreciate we don't want you to be studying alone, and we do run live what's called collaborate sessions, which are a bit like Zoom. And also we have discussion boards in all of our subjects. So that gives you that opportunity to connect and share experiences and learn from others across Australia. Another strength of this course or these courses are that the assessments are very practical and workplace based. So what you learn is going to apply directly to your teaching, and you're going to build those real skills and resources that you can use straight away. And of course, we're here to support you. So you'll be supported every step of the way by us as teaching team. And we've also got other experts in health professional education that provide input to the courses. And we're really passionate about helping you succeed. Next slide. So what do the students say about the courses? Well, I've got some comments from students from last year, and I think this is quite encouraging, but it also does encapsulate about how we go about our teaching. So we do try and create that nurturing learning environment, and ensure that that is a positive experience for our learners. Feedback about the collaborate sessions, they do make the students feel very welcomed, and we do try and make sure that we are approachable and you're able to discuss those real life concerns that you might have. And we're very appreciative that many people on this course have full-time jobs. They've also got family responsibilities as well. The other feedback we get from students are around the structure, and we have some positive feedback about how well the course is structured, where we've got those clear learning outcomes set in place, and what we deliver and our learning is really applied to that real life and their experiences of their teaching in their workplace. So that's a little bit of a flavour of what we offer, a little bit of feedback from what the students have said, and I'm going to wrap up with any questions. So just the last slide. If you have any questions, please feel free to pop them in the chat, and we'll give you a few minutes if you need to type. Lisa and I are looking very intently in the chat. There doesn't seem to be anything quite on the chat, and that's okay. It's that time of year. Everyone's a bit exhausted. We have given you a lot of information. So maybe what we'll do tonight is we will hold off. You may have questions in your head, maybe let those percolate a little bit. And certainly very happy if you've got any questions to feedback directly to us. Does that sound reasonable, Lisa?
Yes. Oh, we've got to thank you.
Oh, thank you.
I
That's
was
wonderful.
thinking perhaps we were really comprehensive.
Sometimes it takes a bit of reflection. I'm trying to apply some of the principles that you've presented tonight, Lisa, and giving that pause, and hopefully we've created that space for people to have a think. But look, we are very grateful for everyone that's joined tonight, and we do appreciate the interest in the course. And I hope you've got something from the session tonight, learned a little bit about those tea moments, learned about questioning and how you can create that space for effective questioning. I will just move on to the next slide, if that's okay. So you may have been getting some materials from JC about the webinar, and it has been a webinar series. We have had a number of webinars prior to this one tonight, and we're ever so grateful for the interest. But these are some of the up and coming webinars. So we have a webinar on the 12th of November, which is being hosted by Public Health and Tropical Medicine, which is part of our college, and it's looking at pre-hospital and retrieval medicine. Very interesting topic. And then the series will also wrap up with a lifestyle medicine webinar, which is looking at careers in lifestyle medicine. And I understand that's going to be hosted by Dr. Sam Manger, and there will be graduates from his program coming to talk about their experiences post completing the qualification. There's a QR code there for registration, and you can also view the recordings following this link. So thank you everyone for joining. I understand as well you will be getting a QR code for feedback as well, and we'd really appreciate some feedback on how we went tonight and any outstanding questions you might have. But thank you very much for joining this evening. And
Thank you, everyone.
thanks, Lisa.